Hello, welcome to today's dose. My name is Shirley and today we're going to talk about the diagnostic criteria for depression. Did you know that the WHO described that there's about 237 million people suffering of depression globally at the moment? It is not unusual to sometimes feel sad or unmotivated. This does not mean that you have a diagnosis of depression. If you feel like you need help or if you feel like you might apply for the diagnosis, please make sure to go and check up with a doctor. In order to have a diagnosis of depression, you must show 5 of the 9 symptoms attributed with such. Also, one of those 5 symptoms must be anedonia or depressive mood. The 9 symptoms attributed with depression are depressive mood, anedonia, fatigue, weight change, sleep disturbance, loss of concentration, thoughts of death or suicide, feeling of worthlessness, and psychomotor agitation or retardation. These symptoms must cause significant distress to the person, being in their social life, in their work, or in their daily life. Also, the symptoms cannot be related to any other disease or substance abuse. Lastly, to have the diagnosis of depression, the patient must have not ever shown any episode of mania or hypomania, since this would change the diagnosis. Now, let's break down each symptom. Depressive mood can be shown differently in different people. For example, in children and adolescents, we see this as increased irritability. There's one important thing about depressive mood that we must talk about, and this is that we should know how to differentiate it from grief. Grief is a normal feeling that people experience when they lose something or someone. Grief has 3 key differentiation from depression. First, we have that grief comes in waves, and also we present with positive memories of the thing we lost or the person we lost. In contrast, in depression, we see this depressive mood frequently and very present for at least 2 weeks. Second, in grief, we don't see a change in self-esteem. Persons maintain the self-esteem they had before the episode, while in depression, we see low self-esteem and also thoughts of unworthiness. Thirdly, in grief, we can see that people may have thoughts of death, but these are related to wanting to join the person or thing they've lost. While in depression, we see the suicidal thoughts related to the feeling of unworthiness and guilt. The next symptoms is anedonia. Anedonia is when a person loses all interest or does not feel any pleasure of the activity they usually enjoyed in the past. This can be shown in different ways. One way is that they may show symptoms like loss of libido, loss of ability to relate to others. Also, we can see that as social withdrawal. We can see people faking emotions. And also, we can see people being unable to feel happiness. Then we have weight change. Weight change can be an increase on the weight or a decrease in weight. In children, we will usually see this as a failure to gain the amount of weight and height allotted for their age. More scientifically and by studies, we have shown that a significant weight change is described as a weight change of 2% in 1 week, or in 6 months, a change of 10%. We also have sleep disturbance. So what do we mean with sleep disturbance? This means insomnia or hypersomnia. This symptom can vary person to person, and that's why it's not described or measured by hours, since everybody has different time that they must rest. Insomnia is when someone is unable to fall asleep. Another way we can see this is as someone who wakes up frequently during the sleep. Also, in children, we can see this as being unable to fall asleep without the company of a parent or someone who is in charge of them. Hypersomnia is someone who rests more than normal. This means that someone will sleep their allotted time at night but will wake up really tired or with a lot of fatigue. In the other hand, we have fatigue or loss of energy. This we can see as physical and also as emotional symptom. As physical symptoms, we can see someone that is presenting with muscle ache or shows inability to move normally. As emotional symptoms, we can see someone who is always tired or someone who always falls asleep. Feeling of worthlessness can be presented by different symptoms. These are physically, people can feel heavy and dull, and also they may experience body ache. Then, mentally and emotionally, they can also present as tearfulness. Also, they can show as having a lot of negative thoughts, social anxiety, and even present with thoughts of death. Then we have diminished ability to concentrate. This may present as indecisiveness and also inability to complete someone's daily tasks. Lastly, we have symptoms that should be taken with a lot of seriousness because this is one of the major causes of death in patients with depression. And this is recurrent thoughts of suicide and death. If you have any of this, please make sure to go to a doctor or a specialist. Very importantly, we must talk about the risk factors of depression. There is a big misconception that only people who have experienced trauma can develop depression. This is not true. There's 4 different aspects that may affect someone's probability to have depression. One of them is the biochemistry. What do I mean with this? There's some people that are predisposed to have depression because of how their neurotransmitters and their chemicals inside their bodies are measured. Also, there is a big genetic factor. There is a study that showed that identical twins may present a higher risk for depression if one of the twins have been diagnosed with depression. This has reached a 70% likelihood that the other twin will present with depression too in the future. Then we have what's personality. Patients that have a negative outlook in life and also a low self-esteem are more predisposed to developing depression. And lastly, there is the social aspect of life. People that have experienced trauma like abuse and violence might have a higher predisposition for developing depression too. If you have any comments or questions, make sure to leave it down in the comments below. We'll make sure to reply. Remember, depression is a really serious illness and should not be taken lightly. Also, we have to remind everyone that there is a possibility for treatment for depression, and there's always a way to find help. Please hit the like and subscribe button and share with your friends if you liked the video, and we'll see you in your next jokes.